most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to fix wrist pain with decompression plus 3 stretches that you can try.
Right.
So very cool. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload it every day. Also, we'd advise you to go to our website, bobandbrad.com, because if you go to the giveaway section, you can sign up for one of our contests. We're always giving something away. This week, we're giving away the Massage Gun by Renpho. Really cool device. Now, this thing has percussion, and when it hits there, boy, it does a good job.
Did you get that, Liz?
This thing is high end.
Yeah, it's
and we're giving away 2 of them.
it goes deep.
Go to Bob and Brad on Facebook. It's also pinned to the top of the page there. Go to Twitter and Instagram for our 60-second version of our daily program. Brad, take it away, sir.
Bob, wrist. Now, where this video is, if you've got a stiff wrist, painful wrist, oftentimes that may be associated with overuse, repetitive motion, arthritic. You get up in the morning and it's stiff and painful. And these are some that I use personally, and I worked with patients as well, so we're sharing them to our guests and our viewers. So.
All right, sounds good. Let's go.
Oh, we're ready. Okay, number 1 is simple one. Just arms out. Yeah, I'll go this direction. Keep your fingers straight and flex, and then up and extend. Okay, do that 3 to 5 times. So you go up as far as you can, down as far as you can, and then you're going to do it with your fingers flexed and pull them up this way. It works different muscles, particularly when you flex. Do it again, 5 to 10 repetitions. Okay, now we're going to add, you have to do one hand at a time because one hand is going to work, and do some extension, passive range of motion. One, you're going to go not on your fingertips, but over your fingers and the base knuckles, and stretch like that, and hold, stretch and hold, and relax. Hold and relax. Now, if you've got a painful wrist and you're doing this, and any of these create sharp pain in the wrist, then you either don't do it near so hard so it's not painful, or don't do that particular stretch.
That's a red light exercise.
Yeah.
Then.
The red flag, you don't want to get into that. Now, you can also do it down palm on palm, and stretch, and then you have your fingers out of the picture. You see my fingers are wiggling. That isolates more of the wrist. And then you can do it down as well. Same thing here, palm on the top of the back of the hand, stretch like this. And if you want to get more aggressive, fingers over the palm, so it's back to back, roll it all the way around and bend the fingers. That you'll feel up in a different location. Yeah. So do that 3 to 5 times. And again, I like just to hold and relax. Hold and relax. 3 to 5 times is good. Okay, do that to both hands. I'm going to skip one of my hands just for time's sake.
Sure.
The next one, now this is distraction or traction. You're going to have to zoom in on this, Liz. And this is one of them that helps me. Okay, are you right in on my wrist? So I'm going to take my hand, my thumb's going where my thumbs are there, and the other finger's here. You can do it this way or this way. Now, this is a wrist that's getting distracted. This arm, you have to really learn to relax completely on this side. Hold your elbow still, relax the forearm, and I'm just going to pull out. Can you show where that sulcus sign is?
It's right in through here. As he pulls out, you'll see there's like a little indentation.
Yeah.
And that shows you that you are getting some traction. I think they can see that, Brad.
Can you see that? So the joint is actually distracting or pulling away from each other. It's not very far, but it's all you need to get some synovial fluid in where it needs to go and stretch those tissues. And now this next one is a really acute one. Focus right in here where the ulnus and the radius are, and I'm going to gently distract. I'm going to stabilize the hand with this hand and do a little rotation. So my hand is stable, but the wrist is getting that rotation. Is that pretty clear? Good. And you do that 5 to 10 times. Okay. Bob, do you want to show them? This is a bonus one.
Yeah, sure. This is one, it's a little complicated, but let's say I'm going to stretch this wrist. You're having pain. The idea is you want to be able to move without pain. Let's say it hurts when I move it.
Mm-hmm.
So you're going to grab your wrist with the 4 fingers. These 4 fingers grab the wrist.
So both palms are
Yep.
up.
And you're going to use the thumb to push the hand this way.
Okay.
So I'm pushing the hand this way. And while I'm pushing it, now I got my hand here, a counter force here. I'm pushing like this. And now move it up and down. Does it feel better?
Okay.
If it does, go ahead and do 5 reps. And you can repeat that throughout the day then.
And if it doesn't?
If it doesn't, don't do it.
Okay.
I'll do it on the other side.
so
Grab 4 fingers around the wrist. Thumbs pushing.
And he's right below the pinky on
Yep.
that padded part of
Up.
your thumb.
Yep.
Or your
And
palm.
pushing, and I'm going to go like this.
Yep.
I got a little Dupuytren's contraction on here, but
Yeah.
that's why I'm.
So from
Yep.
here, the thumb is there. Here, push. And
Yep.
that one might take a little practice. You know,
Yeah.
that's a therapy one, but we think it's something that people can
It's
do.
worked well for me.
Yep.
When I feel like my wrist needs to be cracked,
Yep.
it seems like it works
Yep.
well for that.
And these are the ones that I do when I feel I know I got that. Is it lunate or the hamate that
Sure.
it has an issue?
Hook of the hamate.
That there's a lot of little bones there. Sometimes
Yeah.
it's hard to remember it at our age.
Now you always want to finish with just doing a few circles
Yep.
and shaking it out.
Yep, just
Shake it
kind of
out.
work it out,
Shake it
shake it
out.
out, jelly. Not real aggressive like you're trying
Yeah.
to get egg yolk off your fingers. You know, it's just a nice gentle shake.
All right,
Take a
jazz
deep
hands.
breath.
Jazz hands.
I never do.
Yeah. All right. All right. Remember, we can fix this about anything.
Except for
A broken arm.
there. Yeah, there it is.
Yep. Can't even lift it.
Yeah. Maybe we could do that. Lift. You think that he could edit that in?
No, it'll float up. Thanks for watching.